Let's switch gears to our OB procedures. Now, these procedures are all things that can help with a successful and safe delivery. So, first up is an amniotomy. This is to help induce or augment labor. This is when the provider is going to break that bag of water. So, remember this star point. We must confirm that that fetal head is engaged at 0 or positive station. That fetal head acts like a cork on that cervix, so it's not going to let anything slip by the head. If that baby is not engaged, you can have a cord prolapse where a cord slips past that head, and that's an emergency. We'll be monitoring fetal heart rate before and after an amniotomy. And of course, we want to make sure we assess TACO after that fluid rupture. So that's that time, amount, color, and odor of amniotic fluid. Now, some clients might have an induction of labor if they need to deliver early or if they haven't gone into labor on their own. We can do this by giving medications. So prostaglandins, these are used to promote cervical ripening and softening, or that effacement. And then oxytocin, this is used to stimulate uterine contractions. And remember, oxytocin is going to increase that strength and frequency of uterine contractions. So if it does too good of a job, it could cause uterine tachysystole, and we need to monitor for that. Uterine tachysystole is when we have over 5 contractions in 10 minutes, and this can cause fetal distress. So if this happens, you need to stop that oxytocin. Now, if your client's labor becomes prolonged or there's any fetal distress, the provider can assist with delivery with a vacuum or with forceps. The nurse's job is just to assist. So what can we do? We want to ensure that client's bladder is emptied to maximize the pelvic space and prevent any injury. We're going to assess that mom for any perineal trauma that might have occurred from those delivery instruments. We'll be monitoring that newborn for head trauma that can happen and jaundice. So these instruments can cause bruising to that fetal head and trauma, and that's going to increase red blood cell breakdown, which can increase bilirubin and jaundice in these babies. Let's say your client's laboring and that head gets kind of stuck. The provider might need to create a little extra room, and that's with an episiotomy. This is a surgical vaginal opening that's going to allow a little extra space for that head to exit. Now, this is going to cause a lot of bruising and swelling for that mom. So we want to provide perineal care like some ice packs. And of course, we'll be assessing for healing and any signs of infection.